I didn't realize my video wasn't on. Sorry about that.
Good.
I've been on
Hello.
video all day, it seems like.
Oh man, I'll tell you, one to the next. Hello, everybody. I want to welcome you to the fifth installment of our weekly regional report out calls. This is January 12th at 3:30 for the Northwest region of Kansas. We'll be here at this time every week to give you a snapshot of what's going on with the COVID response in your region and some of the numbers. This call in particular, we'll spend the second half of it focused on the vaccine rollout. Governor announced her plan this week. And make sure I get it right, special advisor to the governor on the vaccine rollout is going to be giving us a quick rundown of how this works. And so that's good. I also want to just point out, if you'd like to get this email every week, go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs with an S. We'll have some of the vaccine data attached. We'll have the dashboard attached. So it's just a great tool for you just to know what's going on in your region every week. So I'll start just by reviewing the numbers here. And we got Jason jumping in here. So let me put up our stats for this region and we'll go from there. All right. So as you can see here, I'll focus. I scribbled down the numbers from last week so we could see where we are. So as far as hospitalized, confirmed or suspected COVID patients, last week, this region was at 40. This week is at 58. So a higher census of COVID patients across the region. When you come to ICU beds, that's actually down. That was 9 last week with COVID patients. Now it's 7. And then as far as available beds go, good trend here, 10 last week, 13 this week. So we've moved from 42% to 54% available capacity as far as what's going on inside the hospital system. Then coming down here to the case count and the caseload, you can see, we don't want to get back up to these numbers where we're over 800 every week. Good stories out of Western Kansas around this. We did see a slight uptick this week from 330 to 370. Obviously, we'd rather see that go in the other direction. Positivity rate slightly above the state average of 13.1%. That's I got that from KDHE. So 13.1% this last week is a positivity rate for the region. The second page of this, as it gets sent out, you can see what's going on as far as what percent of the population is tested positive, and a census of the ICU beds of what's going on in the region. So the hospitals are managing and able to manage this. We just want to make sure we keep an eye on the caseload and what's going on there. So I'll come back here to our group and see if Jason, you have anything you'd like to add from a public health standpoint on what you're seeing.
Sure, I appreciate you having me on. We're seeing similar trends here in Ellis County to what Northwestern region is. We saw a slight uptick in the last week of cases. We have still, we're still far off of our high, which was back November 23rd. We've seen a real precipitous decline really through the holidays and everything else. So we have seen a small increase in cases. Hopefully that continues to stay low and we do see positive trends. Other than that, it's just figuring out how to handle a COVID year, I think, for all of the Northwestern region and for all of us trying to figure out how to get through the vaccine. The bright spot for us is that we do have vaccines in Ellis County. We need more and we need them faster, and we're ready to give them. The system's in place, but we need the actual vaccine. So that's kind of where we're at in Ellis County, and I think it mimics exactly where all of the Northwestern region's at.
It's a great update, Jason. Thank you very much. Appreciate that. Let me turn it over the hospitals. Shay, if you can introduce yourself and just give us a little perspective of what you're seeing.
Sure. Yeah. Shay Veach, Vice President of Regional Operations here at Hayes Med. Just want to echo what Jason's saying. We saw, thank goodness, a little bit more of a levelized number of patients in Northwest Kansas, and and again for Ellis County. Did just get off the phone with a group of some critical access hospitals in Northwest Kansas. Today, they've seen a little bit of an increase in the ED volumes and clinic volumes with patients coming in. So, but I think, it's more of a controlled. Today, and again, I want to emphasize, when I talk about numbers, this is not just Ellis County. We're a regional referral center. So, I'm talking about patients from all over, but today we had a total of 26 inpatients. 21 of those are active COVID patients, 5 recovering, a couple on vents. We did have a death yesterday. We actually, over the weekend, our numbers went down, and we see this all the time. We discharge, they come back in from all over. We've got, patients, a couple from Oklahoma. We've got patients from Eastern Kansas. When folks look for places to transfer to, they don't really care where. And I heard a statistic, our director of nursing said that somebody was trying to transfer, and I think it was out of Oklahoma. We were the 36th hospital that they had called for, and was able to actually get a patient in, which is great, that we were able to accept them and get them in. So, but overall, I think right now our focus really, is working collaboratively with Jason and the local First Care Clinic, FQHC here in town. It's the vaccines. We've vaccinated over 700 of our associates now, which is great. That's about half, but we've still got a long way to go. I think we've done a good job of identifying those frontline healthcare workers in the community, and we've gotten them in the arms. I think we've got a great plan that we've worked through with Ellis County, and we're ready to go. We just need the vaccinations and get them into arms as we move forward. You're going to see a strong push from us from a public service announcement, and that's around vaccination and our support of the vaccination. I know there was a panel of physicians this morning who kind of tag teamed and put all of their thoughts together as far as pregnant, those who want to become pregnant, that population, all the way across the board, and it's a safe and effective manner to vaccinate folks. I had my one. I haven't had my second yet, but I will say, I didn't have any reactions whatsoever. Had a little bit of felt like I got kind of hit maybe by a baseball in the arm, but nothing major, just a little bit of ibuprofen, and I was fine.
Great, Shay. Yeah, I've heard even some of the people with the side effects are maybe a little stronger on the second shot of Pfizer. They're still less than what they're seeing from people with COVID, so they prefer to have the side effects for a couple of days. All right, thank you, Jason. Anything you'd want to add to that after hearing him talk?
No, I definitely think sharing Shay's message of the vaccine is a good thing. The vaccine is a great thing for our community. It's what's going to allow us to move forward safely. And so I think encouraging people to research it. If you're fearful of this, research it, look at it. The safety is there. The efficacy is there. We don't have it. The dose is not there. Unfortunately, we need that. We need Topeka to provide that to us. But the data is there that it's safe, and it is a great, like I said, I think last week or a couple weeks ago, it's a vial of hope. It's a box of hope, whatever you want to call it, but it is definitely the way that we move forward. So encouraging loved ones to get the shot, encouraging yourself to do it, making sure that you understand it, research it, and move forward.
Yeah, I've just heard on that same call that Shay was mentioning that the state has received roughly half the amount of doses that it was promised in December. So I know they're trying to push it out, and so grateful for you all having plans ready to get that out as fast as possible. And we'll pivot here to Seth as we're talking about the vaccine. Seth Conkle's been a part of these calls on the South Central region and recently was appointed special advisor to the governor on the vaccine rollout. He's going to walk us through that plan on this call. So Seth, why don't you jump on and I'll make you the presenter.
All right, thanks, John. Well, yeah, let me just take a couple of minutes and kind of share the plan that was rolled out last week by the governor in coordination with the governor's office, KDHE, KDIM, and a variety of other state agencies. But before we jump into that, I do want to share a couple of definitions because I think it's important to understand these definitions before we jump into some of the conversations and some of the plans. So we were hit, the state of Kansas was hit negatively in the press a couple of weeks ago due to it appearing as though we were behind in vaccinating people, and we were the lowest state in the country to have a very low vaccination rate. And that was really due to a lot of data lags. I think the easiest way to explain that and kind of get a better picture of where we're at and where we're going is with these definitions. So that first piece is allocation. This happens all the way through the process. The federal government allocates on a weekly basis how many doses of all of the supply that Kansas will get. Kansas then goes through, looks at a variety of different data points and decides how much each of the local jurisdictions and providers will get. And then there could even be at the local level some allocation happening to their local providers. So if a local health department decides, hey, we only want to vaccinate this number, we're going to, again, go ahead and allocate more to other providers. There are plans and processes in place to do that. But all that ultimately means is basically a spreadsheet. So nothing has actually changed hands based on an allocation. The actual physical movement comes when we talk about distribution. So we're seeing as soon as those plans and those allocations are made, distribution occurs, moving it from federal warehouses to state warehouses, and or in our case, in most cases, it's going directly to the provider based on those allocation numbers. And then finally, we have getting it into the arms or dispensing. So that's administering the vaccine, administered doses, vaccine administered, but again, it's considered dispensing. All of that to say, to help paint a picture and to help provide the terms that, again, information or data points that you may be seeing in local, state, and national news. So as we talk about this entire cycle from allocation, so right now, or actually later this week, the state gets notified how much the federal government will have available for them. They figure that out. They, again, identify those providers that need it most based on population, currently based on healthcare providers who maybe aren't covered and didn't have enough vaccine the first time they received it. They put that into the federal system. That goes through the process. That distribution happens. It gets shipped from the feds to that provider or to the state. And then we have dispensing to where it's actually at the local level, getting into people. So that process, could be anywhere from 6 to 7 days up to 10 or more days. So that's where we're seeing a lot of the data lags. And I do want to jump into a couple of those data points here in just a second. But before I jump off this slide, I want to talk about points of dispensing. Hasn't come up a lot, but something that you could see coming up in the future. It's basically the physical location where you would go to receive your vaccine. This has been a public health specific kind of term that's been used over the last 10 to 15 years and really kind of geared towards that mass vaccination. So we have a lot of vaccine, we want to get through a lot of people very quickly versus that one-off appointment that you're used to with your doctor's office. So with that in mind, I want to jump into the other part that the plan rolled out last week was this new website. So that website is kansasvaccine.gov. Again, kansasvaccine.gov. That's going to be your main one-stop shop for any Kansas resident who has information, questions, wants to know how many people have been vaccinated, et cetera. This website is continually being updated and built out as we go through this response effort of the vaccine. As you can see, there have been over 84,000 doses administered in the state of Kansas as of 4 p.m. yesterday. So again, this is another data lag that I want to kind of point out here is, as you can see here, these are reports of doses recorded in the state's immunization database. So at 4 o'clock yesterday, for all the people who were doing all the great work of getting doses into people yesterday, unless they have an electronic system that's talking to the state system, their counts may not be in here. It may take today or tomorrow before they can take that paper copy at their vaccine clinic and get it uploaded into the database. So again, we do see a lot of data lags, but you will notice that Kansas has jumped up actually quite drastically in the last 2 weeks from being at the very bottom. This website also has on there some safety guidelines about the vaccine. I heard you guys talking about it as we jumped on. So if you're wanting more information about that, there are bullet points and information here you can grab. The FAQs, again, more safety, more just general questions about the vaccine. And again, that's the piece that's really being built out as we get more and more questions from the public. And then finally, kind of helping distinguish between fact and fiction, maybe dispelling some of those rumors. There's a section on that. But ultimately, the section that everybody wants to know is, where do I fit into this vaccine schedule and these priority lists? And then where do I get vaccinated? So in order to get that information, you're going to want to come here to the availability page. Once you're on the availability page, there's going to be two things you're going to look at. You can look at a very high level overview by clicking on the vaccine phases by population. When you do that, it's going to bring up this one-page document that again tells you currently who the state of Kansas is vaccinating in phase 1. You can be prepared to look at if as we move into phase 2 and throughout the entirety of all 5 phases. Down here, it identifies where we're kind of at or when we anticipate being able to move into the next phase. And that is really due to vaccine availability. So how fast it's rolling off the production lines. So this, again, is just a one-pager. It doesn't really tell you a deep dive of do you as an individual Kansan where you fit. So in order to do that, you're going to want to click on the vaccine prioritization plan. When you do so, it's going to bring up a 10-page document that kind of has a page per phase or multiple pages per the segments of the phase. For example, it's really easy to identify or define 65 and older. So 65 and older does not have a page. However, when you talk about high contact critical workers, we do have a page that helps identify that. So on this page, there's 3 components. The most important component of this section is this definition. Again, don't look at this as a group, but look at this as more of you as an individual. Do you meet this definition? If so, then this is the phase that you would fall into. There's a description and some background about how this particular segment was identified within this phase. And then there are some groups, and these are very high level groups. These are not all inclusive, but ultimately just trying to paint a picture for some of the people that may fit into this. So I do want to pull out, I'm going to pick on retail workers, for example. If you're a retail worker, you work for a retail entity, however, you're the bookkeeper, and because of all of this, they've got you working at home. Just because retail is listed here does not mean that you fit the definition of high contact. So again, you have to meet this entire definition to truly be considered in this phase. If you don't fit in this definition, continue to go down the document until you find a definition that you do fit into. And again, this is not a sprint. This is going to be more of a marathon. There will be enough vaccine to get everybody both doses that they need. Right now, these groups have been identified. For example, 65 and older is where we're seeing far more infection rates, or far higher infection rates and death rates in those groups. So that's a good reason why this group was chosen. But ultimately, this is going to be your spot, John and team, for where you can go to find information. And I think over the next week or two, you're going to see a lot more resources out here on this website as more of those resources are developed and released.
Wonderful. What questions do you guys have for Seth? Well, we got the special advisor here with us. Anything, Jason or Shay? He does a nice job, doesn't he? Thank you, Seth.
No, I don't think I do.
Absolutely. It was an honor to be here and be able to share this information with you. And we definitely look forward to being back or getting you more information to share with the various regions, John and the rest of the group as more information becomes available.
I saw Jason unmute himself. Jason, do you have
Yeah,
something?
Seth, I do have a question. So we've heard the governor say multiple times, or at least a couple of times, that we are not moving to phase 2 until February 1. We're not moving to phase 2. We're supposed to reallocate, ship vaccines all over the state to get out of phase. When does that stop? When do we get to just start vaccinating people? Because we need to move to phase 2. By the time we continually allocate vaccines and try to move them all over the state to finalize one small subset in a corner, we could have already vaccinated several hundred people in our own community or more. So what does that look like? And I know you don't have a hard, fast time frame, but when do those phases play out?
Yeah, so I think it's a good question, Jason, and I think you're going to see us move definitely by the end of the month, if not sooner. I think that making sure that our healthcare system is taken care of across the state is obviously something that one of the groups that's been hit the hardest, and we need to make sure that infrastructure stays there. As for what that looks like and kind of that I think that question that you're asking about that movement piece for future phases, I don't think we know. I think we know that when we do get to phase 2, which again, hopefully that will be very, very soon, based on that vaccine availability, and we've seen some pushes at the federal level to go ahead and release more in the last 24, 48 hours. So I do know that when we're in phase 2, we're going to be there for a while. We've got a lot of people, a lot of Kansans in that phase that again have been identified in that phase for a particular reason. So then again, what that looks like at the local level as we continue through the phases, this may change. And again, if we want to learn one thing from COVID is that change is consistent. And as we do have new information, I think we're trying to do the best we can to get that information out there and let locals make the decision as soon as we feel comfortable that the healthcare community is covered.
Yeah, and to highlight that, just to paint, because Jason and Seth probably already know this, but for everybody else. So when you enter phase 2, each county does have the ability to kind of prioritize the groups that are inside phase 2 and how they want to push that out. And I think, Jason, I'm sure you guys are already making plans or have made plans of how you're going to execute through phase 2, when it comes. So there's a push to local control as it moves from one phase to the next and how you attack that larger subset inside the phase. Is that correct?
Yeah, I mean, absolutely. This was a guideline. These were all based on science and information from the ACIP at the federal level, and in the 3 to 4 months that they put into this to identify all the risk factors that have gone into and where the people that have those risk factors, again, where they may work, live, the types of jobs that they have, and trying to mitigate and get vaccine into the people that need it the most. And I think we're right there with you, Jason. We want to see, I personally would love to see, clinics in the state have to stop running because we are out of vaccine. That's how quickly we are getting it into people. So we're right there with you. We want to see this happen as quickly and as efficiently as possible.
And I can tell you at the local level, that's 100% our goal is to, I don't want to ever see a vial sitting in a refrigerator, and I don't want to ever see a vial sitting in a cooler going from one county to another. Like those vials do nothing until we are able to administer them to people. And so the quicker that we can get them into people, and especially that population 65 and over, because we know for a fact that they are an overwhelming component of the mortality index. And so that once we can get to that point, that is where we will see some significant impacts and getting those significant doses out. So I appreciate you being on here. Nobody wants to be on the hot seat. I will give you a quick support. Nobody ever wants to support the guy on the hot seat, but Ellis County's experience with vaccines, exactly what you're talking about. So we received our vaccine within 3 days. We had administered all of the vaccine that we had received at the Ellis County Health Department. It wasn't a large amount of doses. It was 80 doses. We need more. I think I've said that a few times. You get that memo. But within 3 days, we had all of those out. It took us until yesterday. So that was on the 25th. So 2 weeks later, we were finally allowed to sign up for the federal vaccine registry. to where we could actually register the doses that we had given 2 weeks prior. So nobody ever trusts the government, and people probably don't trust me, but I will say the data lag is a real thing. We weren't able to record our doses. Now, we recorded them in the state system immediately because we were set up for that. But the federal system, where the state's kind of taken a beating from, there was a huge data lag, and so we're bringing people online. I think that has been rectified, but now we just need the vials.
Yeah, absolutely. And I think obviously that message is being heard loud and clear, probably at the federal level, with the information that's come out that both President Trump and President-elect Biden seem to be wanting to see more vaccine hit the road and hit the local level as soon as possible. So hopefully we can continue to work together.
Thanks for all you're doing for the state. Jason, thanks for what you're doing for Ellis County. Shay, thanks for what you're doing in Hayes and for all the communities that feed into that. We're wrapping up on time. 3:30 every week is the Northwest Kansas Call. Encourage you to sign up for the email at covid.ks.gov/report-outs. Highlight for this week is here, Virginia Garver, 101-year-old polio survivor when she was a kid, just got vaccinated. As we're talking about vaccines, I said everybody was so happy. They were wanting to dance. Anyway, so just a great story there if you're following it as these things are getting rolled out to the people who really need it. So thank you, everybody, for being on today. I appreciate your time, and we'll see you this time next week. Thank you very much.
Thank you.